Good evening, everyone. Hope everyone's having a great conference. I know I am. It's a really exciting place to be. I'm Josh Komenda, president of Veyo, and I'm here today to talk about healthcare transportation. Everyone today is talking about social determinants of health, population health. I'm here to talk about a specific part of that, transportation, and really how it can change people's lives, improve outcomes, and lower costs overall. 3.6 million Americans miss appointments or delay care because of transportation challenges. Many low-income Americans don't have access to a car in the family, or living with a chronic condition which makes driving difficult or impossible. A Florida State University study suggests that $1 invested in transportation in a healthcare context can return $11 in healthcare costs. Basically, think about that. Providing those who have transportation challenges with a better way to access care gets them diagnosed earlier, keeps them compliant to treatment plans, reduces no-show rates for healthcare providers, thereby just generally improving the overall system, making it more efficient, improving lives, lowering costs, dramatically changing the healthcare system. 10 years ago, rideshare companies changed the experience for consumers in ground transportation. For routine trips going to the airport, we used to put up with, 10 years ago, we used to put up with unreliable taxi cab systems that would take an hour to show up, or drivers wouldn't show up at all. It was expensive, unreliable, untracked, unpredictable. But all of a sudden that all changed with transportation network companies and ride-sharing companies. But for many patients who live with chronic conditions or have special needs, those ride-sharing options don't always work for them. We decided, at Veyo, we sort of saw this opportunity. This massive advancement in tech-enabled transportation, health plans that were looking for better ways and more reliable ways to get to their patients more reliable access to care. We decided to take this new tech-enabled transportation and make it work for healthcare. So what exactly is Veyo? Veyo's full transportation benefits management, including ride-sharing designed for healthcare, and specialty modes of transportation included as well. We're the only transportation network company or ride-sharing company specifically designed for healthcare. Drivers get CPR, first aid, ADA training, door-to-door training. Our drivers are set up to help those who may be visually impaired or hearing impaired, need help from the front door, don't have a smartphone, don't speak English, are living with a behavioral health challenge or intellectual disability, kids with autism, etc. We're full service benefit management. So we deliver transportation benefits for over 6 million members nationwide. We've done about 15 million trips to date. We really service all mobility needs in urban and rural geographies. So wheelchair, bariatric services, ambulatory, stretcher service, etc. We're first and foremost a technology company. The vast majority of our trips, whether they're ride-sharing trips or specialty trips, are tracked in real time. Plans, providers, patients, and the Veyo team can see where trips are, intervene when necessary, and we collect all those millions of data points to help improve transportation service and have full transparency to our plans as well. Veyo automates everything from ordering to delivery to claims using our advanced platform, mobile apps, web tools, SMS, and IVR. There's a full spectrum of services here. Delivering an NEMT benefit to a plan. We have some customers that have over 800,000 or 1 million lives. Delivering a transportation plan or transportation program with thousands of trips per day is not just delivering the trips. It's also full member management, benefit design, eligibility management, 24/7 multilingual call center with thousands of calls per day. A fleet management system that can help coordinate our innovative ride-sharing system along with our specialty fleets, HIPAA compliance, customer service education, all of our trip management and GPS tracking, fraud, waste, and abuse, compliance, contracting, credentialing, encounter data and grievances, and also the most advanced monthly reporting packages. The large healthcare payers spend millions and millions of dollars a year on transportation programs. We finally have all the data and information available to make sure that deliver everything in full transparency. Veyo is delivering the most innovative ride-sharing system for NEMT in the country, but we also recognize that we have to deliver a full set of other experiences and services along with it. Think about all the complexities of delivering and moving thousands of patients per day for a large healthcare plan. Stretchers, oxygen tanks, urban, rural trips, long distance, wheelchair accessible, behavioral health, encounter data. Veyo's core platform not only manages all of these functions, we also deliver, have apps for members, apps for transportation providers, web tools for healthcare providers, and dashboards for plans as well. Essentially, Veyo sees major potential in delivering a next-generation transportation solution to really meet the needs of healthcare plans, to improve people's lives, improve outcomes. So we're thrilled and excited to be here and be part of the discussion on how we can improve lives. I'm going to be around for a few minutes after the talk. If anyone has any questions, please feel free to stop by or come visit us at booth 614. Thanks very much.